I've seen some worrying trends over the last 10 years as a fellowship-trained sinus specialist in Houston and surrounding communities. Many of my patients have had office sinus procedures that failed, and most of these were treated at just a few high-volume sinus practices that are well known for their factory approach to care. This problem isn't isolated to the Houston area, but is increasingly present in communities across the nation. Unfortunately, the root cause of this trend is financial, leading to biases in how some sinus surgeons think about treatment recommendations. Sinus procedures range from simple balloon dilation of the larger sinuses to extensive endoscopic procedures at a facility lasting upwards of 3 to 4 hours. The indications for these two extremely different versions of sinus care are very different. When financial biases are allowed to influence treatment decisions, patients often end up with quick, profitable office procedures that fail to meet their needs long term. In most cases, the best office treatment is likely a hybrid approach combining balloon sinus dilation with nasal airway surgery and possibly ethmoid sinus surgery, but this can add significant time to these procedures and may require a protected airway with general anesthesia to be performed safely. So how can you as the patient determine if you're getting a non-biased treatment recommendation that is most likely to meet your needs? Number 1, choose an ENT surgeon with a strong background in sinus care, preferably with additional training such as a rhinology fellowship when available. Any surgeon that pursues additional fellowship training likely takes pride in providing the best care possible. They won't be limited by their surgical skills or lack of experience, which can have a huge impact on sinus surgery outcomes. Number 2, you're probably better off avoiding practices known for extremely high volumes of quick sinus procedures in the office. Some of the busiest sinus practices in the country have been developed around strictly offering balloon sinuplasty, and from what I've seen, these provide the most biased sinus care with a high likelihood of failure. If a surgeon schedules 15 sinus procedures in a single day, I would question if they are devoting enough time to provide successful outcomes. I've even treated patients claiming that their prior sinus surgeon refused to provide ongoing care after the procedure when they continued to have problems. If you get the impression that the practice is a factory and you're getting plugged into an assembly line, I would get a second opinion. Number 3, review your CT scan with your sinus surgeon and have them explain where you have problems that require surgery, which procedures they are recommending, and if there are multiple treatment options and how they are different, and ensure that the plan agreed upon addresses all of your concerns that you showed up with and includes interventions to improve nasal breathing when you need them. Failing to correct the nasal airway structures, such as a deviated septum during an office sinus procedure, is known to reduce the chances of a successful outcome. Identifying dental problems on the CT scan can also be critical to success, as upper molar infections will often contaminate maxillary sinuses until the dental infection is cleared. Number 4, ask how long your procedure will last. If you only require a simple balloon dilation and washout of a few sinuses, it may only take 10 to 20 minutes under anesthesia. In my experience, however, most patients require a longer intervention to fully address their conditions. If you need a septoplasty, turbinate reductions, ethmoid sinus surgery, and balloon dilation of multiple sinuses, expect the surgery to last between 1 and 2 hours. Many sinus surgeons, including myself, perform these hybrid sinus procedures with a mix of balloon sinuplasty and traditional sinus surgery to give patients the best possible outcomes through an office intervention. Number 5, when available, choose a practice that can provide a surgery center experience within their office setting. Many practices, including my Houston surgeons where I see patients, have built operating rooms at great expense to enhance the safety and effectiveness of office procedures. These facilities offer general sedation or general anesthesia with a protected airway, which is critical if any sinus washouts or bleeding are expected during a sinus procedure. Anesthesia services are provided by an anesthesiologist, ensuring that patients receive appropriate medications and airway management on par with care in a hospital or a surgical facility. Number 6, perhaps most importantly, choose a practice that provides ongoing management for chronic sinusitis after you heal from the procedure. The inflammation side of this illness can flare up or progressively worsen at any point in time. Improving nasal breathing can increase the amount of pollens and other allergens delivered into the nose and sinuses. If you want to get the most relief and value out of your sinus procedure, your sinus doctor will likely need to manage the condition for months or even years after surgery. Not everyone will need this ongoing care, but knowing that it's available can make all of the difference. Choose a surgeon that is accessible and advocates for the long-term health of their patients by providing this ongoing care. Surgery for sinus problems can provide many benefits over medications alone for quality of life, including fewer infections, less need for antibiotics or steroid pills, eliminating some of the bothersome or ongoing day-to-day symptoms, and often improving the quality of sleep and energy levels. Hopefully, you're able to find a practice that provides excellent care that you can trust, but remember, it never hurts to obtain a second opinion regarding your treatment options prior to having surgery. Good doctors truly mean well and want nothing more than for each and every patient to get the best treatments and to stay healthy long term. Thanks for watching, and feel free to ask questions about these topics in the comments section. If you would like to see me as a patient in Houston or the Woodlands, Texas, visit premiersinus.com or call my Houston surgeons at 713-791-0700. Thanks for watching.